Have you ever stopped to think about the silent work your body is doing for you right now? Even as you sit here listening, breathing, and living your life, deep inside you, your kidneys are filtering, balancing, and protecting your body without asking for attention, without demanding recognition. And yet their quiet strength holds a powerful lesson about resilience, patience, and awareness. Chronic kidney disease in seniors is not just a medical condition. It is a reflection of how time shapes the human body and how wisdom must grow alongside age. As the years pass, the body changes in ways we often do not notice until something begins to feel different, until energy fades a little faster, until recovery takes a little longer, and until the systems we once trusted without question begin to require our conscious care. This is where understanding becomes strength, because awareness is the first step toward protection. Many people move through life assuming that what is hidden cannot harm them, but the truth is often the opposite, because the most dangerous challenges are the ones that grow quietly, without pain, without warning, and without urgency. Chronic kidney disease is one of those challenges, especially in older adults, where the natural aging process already places stress on the kidneys, reducing their ability to filter toxins and maintain balance within the body. This is not a reason for fear, but a call for attention, because when we understand what is happening inside us, we gain the power to respond with intention rather than react with panic. The teachings inspired by Dr. Matthew R. Weir remind us that aging is not a weakness, but a stage that demands a different kind of strength, a strength rooted in awareness, discipline, and thoughtful care. He often emphasizes that the body does not fail suddenly, but rather gives subtle signals over time. And those who learn to listen early are the ones who protect their future. In seniors, the kidneys become more sensitive, not just to disease, but to the very treatments designed to help them, including medications that may affect their function more strongly than expected. This creates a delicate balance where every decision matters, where every choice carries weight, and where personalized care becomes essential rather than optional. Imagine walking on a narrow path where every step must be placed with intention, because rushing forward without awareness could lead to harm, but moving with care can guide you safely to the other side. That is the reality for many older adults living with chronic kidney disease, and it is why knowledge is not just helpful, it is life-changing. When people begin to understand how aging affects the kidneys, they also begin to understand the importance of prevention, the value of routine checkups, and the necessity of listening to their bodies in a deeper way. This is not just about extending life, but about improving the quality of life, because living longer without awareness does not guarantee living better. There is a quiet power in choosing to care, in choosing to learn, and in choosing to act before a problem grows beyond control. And yet, many people delay this awareness, believing they still have time, believing nothing is wrong, until one day they are forced to confront a reality they could have prepared for. That moment, that realization, often becomes the turning point where fear meets responsibility, and where the journey toward healing truly begins. There comes a moment in life when everything feels stable on the surface, when routines are familiar, when the body still moves, and when nothing seems urgent enough to demand attention. And yet beneath that calm exterior, something subtle may already be shifting, something quiet but powerful, something that does not announce itself with pain or alarm, but instead grows slowly in silence. This is where the true challenge of chronic kidney disease in seniors begins, not with a sudden crisis, but with a hidden progression that often goes unnoticed until it reaches a stage where intervention becomes more complex and more urgent. It is in this silent middle ground where awareness either rises or consequences begin to take shape. And this is where many people find themselves unprepared, not because they lacked strength, but because they lacked information. As we age, the body's ability to adapt becomes more delicate, and the kidneys, which once handled stress with ease, begin to require a more thoughtful approach. Medications that once seemed harmless can now have stronger effects. Dosages that once worked perfectly may now need adjustment, and conditions that were once manageable may now demand closer monitoring. This is not a sign of weakness, but a sign that the rules have changed, and those who recognize this shift early are the ones who maintain control over their health journey. The wisdom shared through the teachings of Dr. Matthew R. Weir encourages us to understand that the body is not simply aging, it is communicating, and every small change is a message that should not be ignored. He emphasizes that treatment is not just about addressing disease, but about respecting the individuality of each patient, especially in older adults, where frailty can turn even minor challenges into significant risks. Imagine carrying something fragile, something valuable, something that cannot be replaced, and realizing that every movement must now be more careful, more intentional, because the margin for error has narrowed. That is what managing chronic kidney disease in seniors often feels like, a constant balancing act between action and caution, between treatment and tolerance, between progress and preservation. And yet, within this delicate balance lies a powerful opportunity. The opportunity to take control, to make informed decisions, and to transform uncertainty into clarity. The suspense lies in the fact that many people do not realize how close they are to that turning point, how a small oversight today can become a larger challenge tomorrow, and how ignoring the quiet signals of the body can lead to consequences that are far more difficult to reverse. But the story does not have to unfold that way, because awareness changes everything. When individuals and caregivers begin to understand the unique risks that come with aging kidneys, they begin to see the importance of regular monitoring, of open communication with healthcare providers, and of making lifestyle choices that support long-term health. It becomes clear that prevention is not a one-time action, but a continuous commitment, a mindset that values consistency over convenience. This stage of the journey is not about fear, but about awakening, about realizing that time is not just passing, it is shaping, and that every decision made today has the power to influence tomorrow. In this realization, there is both urgency and hope, because while the risks may be real, so is the ability to respond, adapt, and move forward with purpose. And as this journey reaches its most defining point, there is a deeper realization that begins to take shape, one that goes beyond fear, beyond uncertainty, and into a space of responsibility, strength, and conscious living. Because the truth is that chronic kidney disease in seniors is not just about managing a condition. It is about transforming the way we think about health, aging, and the value of every single day we are given. There is a quiet wisdom that emerges when people begin to truly understand their bodies, when they stop ignoring the signals and start respecting the limits, when they move from passive living to active awareness. And this is where real change begins. The lessons inspired by Dr. Matthew R. Weir remind us that aging is not the end of control, but the beginning of a more refined approach to it, where every decision is made with intention, where every action is guided by knowledge, and where every step forward is taken with purpose. It becomes clear that personalized care is not just a medical recommendation, but a necessity, because no two individuals experience aging in the same way, and no single solution can address the complexity of the human body over time. This is where patients, caregivers, and healthcare professionals must come together, not just to treat a disease, but to support a life, to protect dignity, and to enhance the quality of every moment that still lies ahead. There is strength in adapting, strength in learning, and strength in accepting that change is not something to resist, but something to understand and work with. The fear that once surrounded the unknown begins to fade, replaced by clarity, confidence, and a renewed sense of control, because knowledge has the power to turn even the most difficult situations into manageable ones. And yet, the most powerful message of all is this: that it is never too late to start paying attention, never too late to make better choices, and never too late to protect what matters most. Whether you are someone experiencing these challenges directly or someone caring for a loved one, your role is important, your awareness is valuable, and your actions can make a meaningful difference. The journey may not always be easy, but it is one that can be guided with wisdom, supported by knowledge, and strengthened by intention. Every small step taken toward better health is a step toward a better life, and every moment of awareness is a moment of empowerment. So do not wait for a crisis to take control. Do not ignore what your body is trying to tell you, and do not underestimate the impact of informed decisions. because your future is shaped by what you choose to do today. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.